Good evening. As talks continue to swirl around when and how the economy will be reopened, the province is marking a grim milestone in the ongoing battle against the coronavirus. 86 additional deaths are being reported today. That's the highest daily jump we've seen so far. And it also pushes the provincial total past the 1,000 mark. Health officials say there are 459 new cases. That's 112 more than yesterday. But the number of tests completed also grew significantly by more than 1,300 day over day. Another important figure to watch, the number of recovered patients. That's now at 63%. And with a closer look at what today's numbers might mean for Ontario, we go now to Cynthia Mulligan. Cynthia, tell us what we're hearing today.
Well, Janelle, as you mentioned, the numbers are slightly up. There's a 2.9% increase. Yesterday, it was 2.3%. Ontario's Chief Medical Officer of Health today says it's promising. He believes we're in day 5 or 6 of a gradual decline in cases. Now, Dr. Williams wants to see 14 days of decline and community spread cases well below 200 daily. Right now, community spread cases, which of course are different than long-term care, are in the low 200s. The rest are in long-term care. Premier Doug Ford is certainly sounding more hopeful. He's telling businesses to get ready to open up.
Today, we're on the path to reopening the economy because that curve is flattening. That surge in our hospitals, we avoided it. And that trend is going down. And as the trends keep going in the right direction, as we get closer to the targets we need to hit, as we get closer and closer to opening up.
So today, the government released guidelines for 65 sectors, from retail to automotive to restaurants, on how to open up safely. The safety measures include proper distancing, plexiglass, personal protective equipment. The Premier also had a message to insurance companies: give drivers a break and lower your rates.
People aren't driving. The risks to the insurance companies are much lower, but you keep taking their checks. Start lowering the rates for these people. We're hurting, but you need to pitch in too.
And Doug Ford also had strong words for Ottawa's decision to ban people from going to see loved ones through the windows of their long-term care homes. As you know, his 95-year-old mother-in-law is COVID-19 positive, and he says his wife and family go see her through the window. He is not impressed with Ottawa City Council's directive. In fact, he called it ridiculous.
You know, imagine how heartbreaking that is. You have your mom or your dad or your grandparents up there, and they're wondering what is going on. A lot of them are very confused on why isn't my loved one, why isn't my son or daughter coming to see me? So it puts them in a real state of confusion. But not to be allowed to go look at your loved one through a window and, you know, give them a kiss or put your hand up on the window, that's just wrong. They got to think these things through. Go visit your loved ones, as far as I'm concerned. This is critical, and hopefully it won't be the last time you see them. I'd go to the window.
Ottawa City's mayor has ordered staff to reverse the ban on window visits after a huge backlash. So back to when restrictions might begin to ease. It's really too early to say, but as I told you, the medical officer of health says we're 5 or 6 days into a gradual decline. He wants to see 14 days of decline as one of his markers to recommend starting to open up the economy.